Hello friends, I'm Dr. Sanjay Agarwal, Diabetologist. I head the Department of Diabetes, Obesity and Metabolic Diseases at the Sahyadri hospitals. I'm also the Secretary General of the National Body of Diabetes, the Research Society for Study of Diabetes in India. Now let me sort of give you some facts about diabetes, and something that is very important that we need to discuss is how do diabetic patients cope with their mental health when they are detected to have the presence of high blood sugars. Remember that today we are one of the largest prevalence of diabetes in the country when it comes in the global arena. We have close to about 246 million people with either diabetes or pre-diabetes. But equally important is the fact that we have about 57% of people who are not aware that they have diabetes. Now, once somebody is detected to have diabetes, there's a lot of questions that this gentleman or lady tends to have in his mind, that how is he going to cope with this problem, something, a disorder that is going to be with him all his life. We know today that with the current understanding of diabetes, we do not have a cure. So somebody who's got diabetes has to manage his diabetes well for his entire lifetime, irrespective of the age that he develops diabetes. Now let me walk you through of some bare facts. We have at one end of the spectrum young children who have type 1 diabetes, and at the other end of the spectrum elderly people who have type 2 diabetes perhaps. Now let's start at the spectrum of young children who have type 1 diabetes. Imagine a young child who comes to know that he's got diabetes and is committed to taking insulin all his life. Now, this child maybe needs a lot of help from caregivers, particularly his own family, friends, teachers, and society for that matter. And they are the hardest to cope with because you know education is key to good success. So we have to concentrate on educating the patient, educating the family, educating the school, educating the friends around him and the society around him. He should not feel that he's got something that is abnormal. In fact, we should be welcoming him and supporting him. So, education is to help people cope. On the other end of the spectrum, when we've got elderly people who have got diabetes, they may have cognition problems, they may have difficulty in coping up with their illness, they may have very little support structure for helping them out. And today, in the age of where we've got nuclear families, they may have very little in terms of how people can help them to monitor their blood sugars, give them medications on time, particularly if they are on multiple medications with multiple problems, because diabetes may not come alone. They may have associated other issues like blood pressure, heart problems, which equally need to be dealt with in the same importance as diabetes. And when they're taking multiple medications, they may find it very difficult to cope. There could be instances where their blood sugars could go down and they may not be aware about it, or at times they may just lose consciousness and they may have nobody around them to help. So education of everybody around them and giving them a support structure becomes important so that they are able to cope with them. In between, we've got people who are productive in their years of that they are, let's say, in the second, third or fourth decade or fifth decade for that matter, who are involved in their work related activities, and they have to sort of manage their diabetes as per their work schedules. There could be shift workers who may find it very difficult to cope with how to take their medications on time. There could be sort of meal related issues because a lot of people may not be eating meals at home, and they may be very difficult for them to have structured meals which will help them to keep their blood sugars under control. Now, imagine a situation where somebody falls in each of these categories. How does one cope up with issues related to their diabetes? We do have situations where there could be fluctuations in blood sugars. There could be people who are in meetings and not able to get their meals on time, and they may end up getting low sugars or hypoglycemias. And that is something that is worrisome for us. I'm sure that we should educate not only the patients, but even the work culture around them, the people who are associated with them, so that if somebody has got diabetes, the society at large, the workplace at large, should lend an helping hand to them to see that if they are supposed to eat meals on time, then they're given that privilege to do so. Or if they're supposed to take the insulin shots, or for that matter, medications, then they're given the opportunity to do that without the patient feeling awkward about it. Today, technology is going forward in leaps and bounds. uh, Gone are the days when we had to rely on manual sort of documentations. Today we've got connected glucometers, we've got connected pens for insulin, we've got excellent sort of glucose monitoring systems where somebody can monitor by putting a sensor on their arm, and a 24-hour blood glucose monitoring can be done, which helps them to understand the fluctuations in their blood sugars, detect asymptomatic low sugars. Also, we can structure their insulin dosing or drug dosing depending on when are they high or when are they low. We've got a lot of apps which help for the lifestyle. We've got exercise apps, we've got nutrition apps, we've got also apps which give the education to people. And these are all the benefits of today's world that we've got. That technology is playing a large role in something that we don't have uh, trained manpower to execute. We need to have people to counsel. We need to have trained dietitians. And although we may give all the initial education and hand holding, but if a technology can help them to cope with all these issues, then it makes life a lot easier. I want to sort of give my closing statements to say that today we are living in an excellent world. We know a lot about diabetes. We've got a whole plethora of medications that are available, right from oral medications to insulin. We have treatments which help to deal with problems associated with diabetes. Let's say obesity, heart problems, strokes. We've got institutions like Sahyadri which are well versed to deal with these situations. We've got institutions like Sahyadri which have got all the technology to support patients. And we've got all the infrastructural help by trained teams to reach out to patients and see that they get the best care possible. We should make it our sort of a mission in life to see that whether we are diabetics or we have patients who are, in our family, friends who have diabetes, to see that they get the best possible care and help, and we can help them to cope with their journey with diabetes, to protect them from all the ravages that diabetes brings to them. Thank you very much.